Welcome to Healing with Heart. Simple ideas for profound healing. These videos are meant for informational purposes only, not intended to diagnose or treat medical conditions. Hey guys, Dr. Martin Hart here. Thanks for being patient with me uploading videos a little slower lately. I've been working on some lectures and podcasts for the clinic, so be sure to check those out. Okay, today's topic. I want to talk about one common thing that seems to trigger our neurolimbic system and can make symptoms worse. All right, so our limbic system is a threat response system. Its job is to scan our environment, internal and external, for threats, and then kick in our immune system, our endocrine system, our HPA axis to create that fight, flight, freeze, fawn response, okay, the stress response. So one way that I commonly see patients and myself overactivating this is that when we go from body awareness and we get ourselves stuck in the mental. When does this happen? What often happens when patients are reporting to me, and instead of reporting signs and symptoms or sensations in their body, what they're reporting to me is a diagnosis. Okay, so that's going from staying with body awareness to getting stuck mentating and triggering the limbic system. So what that might look like is, for instance, I'll give you a common example for myself. If I get some pain in my neck, okay, my first thought, and this happens a lot actually to chiropractic and medical students, is you overdiagnose yourself. Maybe if I'm getting stuck in my limbic system is, oh no, I inflamed a disc, right? At that moment, I really have no idea if my disc is inflamed or not, okay? That's my limbic system, my brain kicking in and mentating instead of staying with the sensation. If I stay with the sensation, I can report to myself, I have some pain right here. It hurts worse when I do this, worse when I do this. This seems to relieve it, okay? And actually, if I stick in with it and get a little pressure and just stretch, it makes it almost better. Wow, okay. But if I got stuck on the whole disc idea, wow, I have an inflamed intervertebral disc. Oh my gosh, what does that mean? My brain's going to spiral, right? And my heart rate's going to go up. And my stress hormones are going to go up. And they're all going to impact it. They're going to increase inflammation at that point, right? Which that's going to increase any sort of pain, right? And then that response, because pain all comes from the brain, that overactivation to a pain response is going to create more pain and more feedback there instead of means slowing down and staying with the body awareness. And so other examples of this may be I have that virus feel in my lungs. Well, you have no idea really if you have a virus in your lungs, and neither do I until I can start to examine the situation, right? It might be better to report, and sometimes what that happens, then I'll explain why it may be better to report something different, is it's easy to get over-focused, especially if a patient is very animated and very emotional about that idea. It might get easy to get stuck on that even as a practitioner, right? And it's easy for the patient to get stuck on it. So now suddenly we're spending too much time thinking about a virus in the lungs instead of just figuring out what's going on, okay? So what sometimes will happen is a patient may report to me, I'm having pain in my kidneys. Okay, and so do we know that's where the pain is coming from? We don't, but I might start thinking, okay, kidneys, X, Y, and Z. But when I actually say, hey, okay, show me where the pain's at. Wow, that's nowhere near your kidneys, okay? That's actually closer to your spine and ribs, or that might be closer to your liver gallbladder, okay, or whatever. But because we get stuck catastrophizing and self-diagnosing, it's easy to get stuck in that viewpoint, right? So it might be better to say, I have some pain right here, and it's worse when I do X, Y, and Z. And that can help not only you to stay in your body, stay aware, it'll help the practitioner to sort out what's really going on. Now, you might come across and say something like, okay, I have this pain here in my upper quadrant, right here in my ribs on my right side, and we have a family history of gallbladder disease, and so I'm worried it's my gallbladder. Okay, that's very different. You reported the sensations, and you reported relevant inflammation. You haven't self-diagnosed. Okay, that's helpful. It keeps you out of your limbic system, which keeps some of your symptoms down under control, and it helps the practitioner, right? So it's a win-win all around. Now, this comes about from mainstream medicine, overly focused on labels and diagnosis, and then medical marketing, right? So marketing's whole job is to trigger our limbic system, get our primitive brain going to the basic needs and fear, right? Get it really revved up so you can take action and buy whatever they're selling. It just happens to be that in the medical world, they're selling medicine, right? They're selling disease diagnosis and the medicine to treat it. Okay, so you have to be on the lookout for that and how that's influencing you. All that stuff from TV is its own brainwashing. So you got to parse that out, slow down. Same way that we slow down with the body, slow down and listen to messages coming in and see what you do and don't want. So for the body, slow down, stay in the body awareness, stay out of the limbic system for a minute, and just focus on the signs and sensations versus self-diagnosing. I hope this is helpful. Share it with whoever you think might be benefited, and post in the comments below how this has impacted you.